Good day, students. Welcome once again to Game for Students. Gross and Microscopy Explained. In this session, I shall be dealing with a couple of ovarian tumors which are important both as gross specimens as well as slides for you people. And the significance is given within the enclosure. Serous cystadenoma. It is a benign tumor of the ovary. It arises from the surface epithelia. It is common in the age group of 40 to 60 years and commonly bilateral. It can be divided into a benign, borderline, or a malignant tumor based on the histology. The gross specimen kept for you people can be described thus. It is a mounted specimen of the ovary measuring dash into dash centimeters or so many centimeters in diameter, whatever the case may be. The fallopian tube is stretched over it and it is identified by the fimbrial. This is the hallmark. The external surface is smooth in contour and grayish pink in color. The wall is thin and translucent. That is, it allows light to pass through, but we cannot see through it. A few small caliber blood vessels are seen. The cut surface shows a unilocular cyst which is filled with a clear serous fluid. Sometimes it will be very huge and then containing a few liters of fluid. The wall is thin, 1 to 2 millimeters, and smooth. There are no areas of hemorrhage or necrosis, both externally as well as internally. This is a specimen of the uterus, the cervix. This is partly cut fallopian tube on the other side. This is an intact fallopian tube that can be identified by the fimbrial. This will be like the tentacles of a sea anemone. And there is a large cystic lesion that is replacing the ovary. As I mentioned earlier, it is translucent, it is smooth, and it is shiny. I can see the reflection of the light. And there are a few thin caliber blood vessels in the wall. The medical images bear the vestige. This is again another specimen of a serous cyst. The external surface, as I said, is smooth, and then there is a stitched tubal structure which has got a fimbrial. That is how we can definitely say that it is a ovarian cyst. Please describe all these subheadings. What is the size, the color, the contour, the shape, whether the fallopian tube is there, blood vessels, how do they look, and what is the thickness or the thinness. I find that it is translucent and it is thin. And this is a cut surface. On cutting open, I find that there is a unilocular cyst. There is a single locule. It is cut open, therefore I am seeing it as two. And there are a few congested vessels, and the inner surface is again smooth, glistening, grayish pink or grayish white in color. There are no projections into the lumen, and there are no areas of hemorrhage or necrosis. Such a specimen can be kept for you people in the examination, either as a spotter or a specimen for description or for the viva voce. And looking carefully, I'll be able to identify the fimbrial end of the fallopian tube. And this is also a serous tumor, but then I find that it is almost showing a cauliflower-like growth. There are multiple projections. We used to call it as serous papillary tumors, but in such a case, we cannot say that it is benign or malignant. In fact, it looks more malignant because there is so much of crowding and it looks more solid than cystic. This specimen is unlikely to be kept for the undergraduates, but it is shown for comparison. Multiple papillary projections, there will be stratification, invasion, pleomorphism, and atypia. These are the histological features. Microscopically, this slide can be kept for you. They'll be focusing the slide and we are supposed to make a diagnosis. I'm finding a single layer of a low cuboidal epithelium that is lining. And the point exactly where I am pointing is the lumen of the cyst. And this is the ovary. The ovary is generally identified by means of a wavy stroma. The cells are all not straight, the nuclei are straight. And look at this one. I find a kind of a waviness, and that is a catching point for saying that it is a ovary. And there's a higher magnification. Again, I'm finding a single layer, cuboidal epithelium. Sometimes it can be having a ciliated epithelium. And this is the ovarian stroma that is seen. So cystic space lined by low cuboidal to columnar epithelium, ciliated in some areas, the cells are uniform, supported by the ovarian stroma and connective tissue. This can be a slide for you in their examination. And this is yet another higher magnification. This is supposed to be the intact basement membrane. And I'm finding the tumor lining epithelium, this is the cilia. And this is the ovarian stroma that I'm seeing. Otherwise, what are the sac-like structures that are kept for you in the examination? You people should know. Make a list of it. And for me, probably the urinary bladder can be one, or the ovarian cyst. Very unlikely that you will be kept given another cystic lesion. This is the second tumor, the mucinous cystadenoma. It is again large, maybe not as large as the serous tumor, but it is multiloculated. I can count. I can find 3 locules. And it is again glistening because it contains a mucoid substance. It is smooth on the inner aspect. And they are separated by intercystic fibrous septae. Multiloculated, large, smooth, unilateral, whereas the serous can be bilateral. Again, the mucinous cyst can also be identified by means of the fallopian tube. And the cystic spaces have got mucoid or jelly-like material. So these have been washed off, and again I'm saying it is mucinous because it is a multiloculated cyst. And the cyst wall is fairly thin. I'm able to see a few vascular strands. The inner lining is smooth. It is grayish white, and it will be glistening because it is mucus. So it is a mounted specimen of an ovarian tumor. It measures so many centimeters. The external surface is bosselated because multiple cystic spaces are there. There is an attached fallopian tube, and the cut surface shows multiple cystic spaces. Largest measuring, maybe we can take this as the largest measuring so many centimeters, and the smallest measuring so many centimeters in diameter. The inner surface is smooth with thin septae, and the cysts are filled with gelatinous or mucoid material. Microscopically, this is what we see. This is again, first let us see the stroma. I hope you are able to appreciate the wavy ovarian stroma. And when I go to the cyst wall, it is lined by a single layer of tall columnar cells with a clear cytoplasm and basal nucleus. And this is the cystic space or the lumen. This is again another lesion in which part of the cyst can be invaginating and then there can be appearing as multiple mucus glands. But all of them have got an intact basement membrane. There is no erosion, there is no invasion. And this is the fibrocollagenous stroma, and this is the ovarian stroma that we are seeing. And how do you identify it? It is like this. This we call as a picket fence. Normally we see it at the sides of the railway station or in a garden. They are all tall columnar, and for them to stay in space, there will be a cross reaper that is there, and there will be the nails. So this is supposed to signify the nucleus that I'm seeing over here, and the tall columnar ones will be the cytoplasm. Courtesy web pathology. So mucinous cystadenoma is given here, and there is another tumor. I find that here also there are a few cystic spaces, but it is becoming predominantly solid. I cannot say that it is a pure cystic lesion. Therefore, it is going in for malignancy. Such a case is for us, not for the undergraduate students, to look for any malignant penetration. The tumor is composed of cystic spaces lined by a single layer of epithelium. The cells are tall columnar, nuclei are arranged parallel to each other, which is called a picket fence appearance. And the wall is composed of ovarian stroma and connective tissue. See you in game 16.